And it's a very important speaker because they are working in this farm. They are the trimmers of this farm. They are taking care of the hoof health of this farm. She's Judit. She's a vet. She's working as a trimmer, and she's going to introduce the data from this farm. Thank you, Judit.
Thank you. Good morning. My name is Judit Solana, and I am the veterinarian of Digitrim. As the lineal said, our company takes care of the whole health of Mas Bes. For the last few years, we have been making a monthly visit to the farm. We were check the postpartum cows and the cows to dry. And then visually, we select the lame cows and cows with large hoofs from the other parks to make them the adequate hoof trim and hoof care. Since the year 2020, we have been trimming using the deep modeling system adapted to the needs of the farm. As you can see in the photo, we work with the rotoclip disc with 3 blades. We collect the information with the Hoof Manager program, and now I will give you a little summary so that you know the state of the hoof health of the farm. To begin with, there are 650 dairy cows and about 70 dry cows on the farm. That makes a total of 720 cows, plus the pre-calving heifers. We do an average of 60 visits, 60 attentions per month. 61% of these attentions are for preventive hoof trimming, and 39% are attentions for lameness, because we select the new lame cows and also the lame cows, the old lame cows, in order to recheck them. Since year 2021, we have made a total of 712 attentions for hoof disease. In this graph, you can see the cows that have been treated for lameness. In blue, the cows that have been treated only once. And in the other colors, we can see the animals that have been treated 2 or more times. If we focus on the hoof disease, we can see that white lesions are the most important of this farm and predominate, followed by sole ulcers. And we can see that the toe ulcers are the most difficult to cure because they need more than one treatment. In this other graphic, it shows the distribution of the new lesions by month. You can see an irregular curve to occurrence with white disease, and occasional peaks of dermatitis that appears due to some incidents with hoof bath. During the autumn, there was increased sole ulcers. There's been a higher incidence of toe ulcers in February. And in April, the number of interdigital phlegmons increased, probably due to a change of diet. In closing, I give to you a summary of current status of lameness. First, I have calculated incidence rate, which is the number of new cases of lameness from January for Jan. We see that there have been 107 new cases in 6 months. That in this time, for every for every 100 cows, there are 15 cows that have a new lameness. And to close, I calculate the prevalence rate, which the number of animals at our last visit have a hoof disease. We detected 31 new lame cows and 24 chronic lame cows. With this, we see that the percentage of the lame cows in the farm actually is 7.6%. Thank you very much.
We have George here. He has an interesting life. He was working managing cows in Greece, 600 cows in Greece. Later, he went to the US to work at Cornell University, and now he's working as professor of cattle health and welfare at Liverpool University, leading, in my opinion, the biggest group nowadays in terms of research about hoof health. So it's a pleasure to have George here. He's going to speak about why cows develop sole lesions, and just say thank you to George. The floor is yours.
Thank you very much, Daniel. Thank you. Many thanks to ANKA for this invitation. It's great to be here. I'm very excited to share some of our latest research findings. Thank you, Daniel, for this quick introduction. So as Daniel said, I'm currently working at the University of Liverpool, spending a lot of time on research, but I still do clinical work, herd health work, where I go out, work with dairy farms in the UK, and most of the times we will focus on lameness problems, trying to help farmers address lameness. Today my talk is about some of the latest research we've been doing and how this may help or mean something for the farmer and the foot trimmer. And I do focus this talk on sole lesions. So just to make sure we're all on the same page, so we're talking about, is the laser working? Well, anyway, we're talking about sole hemorrhage, and I include even very early stages of sole hemorrhage. So you see how we have very early stages up to like more severe bruising here. And then we also talk about sole ulcers, which is, in my opinion, in most cases, a more severe manifestation of the same process. So you see here a severe bruising and how then it can get a lot worse and we have a sole ulcer. Traditionally, these lesions, the sole lesions, and maybe white line together, so what we used to call claw horn disruption lesions, there has been a lot of discussion about how it is the main factor behind them is this subclinical laminitis linked to diets and acidosis. And I think there is a lot more knowledge now, and I think it's probably a much more multifactorial situation, and that's what some of the messages I will try to deliver today. We wrote an article when I was still back at Cornell reviewing the existing knowledge. That was 10 years ago, and I think we've added a little bit more to this since then. The main thing I think we need to remember is the thing we definitely know is that these lesions are associated with damage, trauma within the claw capsule on the sensitive tissue, this corium that is producing the healthy horn. So just a recap of this before we go into our new research. Is there a way to make this laser work? Just point with my, that's fine. I like moving around anyway, so. So a couple of things just to remember, and we all talk to what we are talking about. There are certain factors within the foot that are really important in the development of these lesions. So one is, if we look at this red line here, just under the pedal bone, that's what we call the corium. That's this soft, sensitive tissue that is producing the healthy horn. which is the protection here now, your sole and your hoof wall, the hard part that protects the soft tissues inside the claw. The pedal bone is really important, and part of the damage that lead to these problems is coming from this pedal bone that could, especially around calving, put more pressure here, partially because this link, this attachment of the pedal bone to the hoof wall could weaken. And there are many theories on why this is happening. Part of it is the old theory about acidosis and endotoxemia having an effect on the suspensory apparatus here, on this attachment of the hoof wall. We also have done now, there is a lot of work on how important this soft tissue here, this is a fatty tissue called the fat pad, and how important it could be in protecting the sensitive corium from the pressure that comes from the pedal bone. But we also talk a lot about the foot anatomy and how claw overgrowth may be a problem, but how also your sole thickness could be important for protecting the sensitive corium from external damage, external pressure. There is a lot going on there. And on top of all that, we need to always remember that how we manage our cows and the environment we keep our cows on can really exacerbate some of the other factors, can make things worse. So we have things like standing times and comfort and walking distances. I decided not to go into this for this talk. I only have 30 minutes, so I had to pick what I will talk about. But let's not forget the fact that I will focus on other things in the rest of my talk doesn't mean that we should forget about the environment and how we manage our cows. I may manage to talk about some of these things during the workshop later. So, as I said, that was a recap. This is a lot of existing research from other groups, theories. A few years ago, that was now 4 or 5 years ago, we wrote a proposal and we won a fairly large grant from the UK government to study some of these theories, to bring a lot of these theories together and try to generate a little bit more knowledge that could help us understand what's more important, what happens there, what comes first, and so on. And that was in collaboration with 2 other universities in the UK, the Royal Vet College and SRUC. And what we did, and from this study will come a lot of the results that I will be showing to you later, we went on 4 dairy farms, and in a fairly intensive project, we followed almost 2,400 cows quite intensively. So we started a couple of months before calving. We checked them again immediately after calving, a couple of months after calving, and then in mid to late lactation. And at these 4 time points, these 2,400 cows, we picked all 4 feet up, and we recorded all lesions that were present there. We used ultrasound scanning to get certain measurements that I will show to you in a minute. So we measured some of these things I've mentioned before, the fat pad and the sole thickness. We locomotion scored them, and we also got a lot of information on their genetics. So the lesions, if we focus on the sole lesions in this lecture, that was the recording we were doing. So we would record even mild lesions, so bruising on that side, sole ulcers on the other side. Importantly, it was 95% of these inspections, so 2,400 cows, 4 times, they were done by the same person, a vet that I trained in my group who was in charge of this work. So these lesion records are very consistent. They're not coming from various different sources that can be, one way of recording or another. So we have very accurate lesion records. And to start going into the results we have and what do they mean and how can we use some of the results we're getting, very quickly just to show that as expected, and that goes back to what I said, that the environment and how we manage the farms is really important. There was a big farm effect and also a stage effect. So when you look at your bruising, we already knew that the early lactation period, so just after a couple of months after calving, that's when we got most of the sole hemorrhage. You see, we had a lot less before and just after calving. And then a couple of months later, we had a lot more sole hemorrhage. The blue is the first lactation animals, so we had a bit more sole hemorrhage in first lactation. But you can also see that these two farms had a lot more sole hemorrhage or bruising comparing to these two farms. I don't think I have the time today to go into, but I can answer questions, obviously, to go into all the differences between these two farms. But just to add a little bit to the whole discussion, even though this research was not done to answer this question, we did look at the main aspects of the diets on these 4 farms and whether one of these farms had a more acidotic, like risk diet, like a diet that would maybe make cows more acidotic. And there was no really any link between, say this farm that had a lot more sole hemorrhage comparing to the farms that had a lot less sole hemorrhage. So for example, if you look at things like starch, there was very little difference, or your NDF and all that. We then went into some of these anatomical measurements, and we recorded at the same time points, we recorded the foot angle, the heel depth, the fat pad thickness using scanning, and the sole thickness. These results, I thought, I'll place more emphasis in this since we have a lot of foot trimmers here, and some of these results really relate to what you do. And before we analyze the data, I had my own preconceptions and ideas about this. I wanted to run a poll, and I failed to make it work, so we can just do it by show of hands. But if you don't mind, I have these 4 questions. So which one do you think of all this is more important when you're trying to foot trim a cow? To get the foot angle right? So who thinks this? So we have 4 answers: foot angle, sole thickness, heel depth, or they are all equally important. So who thinks that foot angle is the most important? You can just, no judgment, just show of hands. Okay, no one thinks that foot angle is the most important. Sole thickness, we have a few hands on sole thickness. Heel depth, 1 hand, a few hands, all equally important. That probably seems to be the most likely, but we also had quite a few sole thickness and a little bit less probably. It doesn't really matter, just as a curiosity, really. We have been talking a lot about, I think, my perception is when we talk about foot trimming, I think we do talk a lot about foot angle. I do see heel depth mentioned a lot, but I think there is also a lot of discussion about sole thickness. That's where I was trying to get my results back, but that's not going to work. So what did we get in our study? Remember that we have 2,400 cows, very objectively measured, with very consistent records on their lesions. Foot angle didn't seem to be really important. Maybe part of it was that in our population, we had very good foot trimming on these farms, so most of our cows were in this good foot angle, 45, 50 degrees. But it made very little difference. Yes, it was still 6% less sole lesions. So in this, I include severe bruising and sole ulcers. It was not what we call statistically significant. And it didn't really seem to make a huge difference whether if you were to go on this slightly lower foot angle. There was absolutely no association, at least in our data, between the heel depth and the risk of cows having lesions. Keep in mind that when I ran this analysis, I'm looking at these measurements either at drying off or at calving, and at the risk of having a lesion 2 months later. So I'm looking at whether they can be a risk factor or a protective thing for the development of new lesions, because I can exclude animals that already had a lesion. But when we go to sole thickness, we have a very strong association. You may say, especially the people that raised your hands and said sole thickness is the most important, that that's not big news. We probably already know that respecting sole thickness is important. But I think it's really useful that we confirm this on a large data set with very objectively monitored animals. And what you can see here, as you would expect probably, a very thin sole below 5 millimeters. And you can see here how we measure that with our scanner. So this is the measurement of the sole thickness, and this is your soft tissue, your fat pad. A very thin sole, 50%, half of the animals that at calving were found with a very thin sole would have a sole lesion in early lactation. When you go to a sole that is more than 7 millimeters, then that drops to 26%, and that's very significant. You can see that a sole thickness of 5 to 7 millimeters was better than a thin sole, but an even thicker sole was even better. I think that needs a little bit of thinking. Our current recommendations, that includes myself in my teaching, in my lectures, I would go with this, let's keep the sole thickness at 5 to 7 millimeters. And these results to me suggest that we probably need to try and keep more than that, if possible. When I ran this analysis, correcting for a number of what we call confounding factors like farm and parity, and whether you already had a lesion or not, it's still there. And what you can see here, if I use this current recommendation of 5 to 7 millimeters as my reference, a thicker sole is associated with a significant reduction in the odds of having a lesion in early lactation. Again, that's statistically significant. So what I'm saying here is that we may need to think about this and try really hard to keep as much thickness as possible once we have balanced our claws. Because one of the reasons we remove some of the sole thickness is because there is unbalance between, the medial and the lateral claw. And I think it's important to balance them. But then maybe once we've balanced the two claws, we really respect the sole thickness and don't keep taking away because we think that we should reach this 5 or 6 millimeters. So if we move now to the fat pad, the fat pad results we have are, to me, very interesting. They may be less applicable to the foot trimmer because you cannot really change the fat pads with your foot trimming. You can change the sole thickness, so I think it's more important to stick to the sole thickness. But what we have found, and that confirms previous research that was done by the group in Nottingham and the group at Cornell, that we have changes in the fat pad thickness, and especially around calving. That's where we get the fat pad to be thinner. Some of the ideas there is that there is a fat mobilization. Another possible explanation is that this is the pressure from the pedal bone. Around calving, we do know that the pedal bone that's the time that gets a little bit more slackened, like relaxed, and may puts more pressure on the fat pad. We do also have some other interesting results. This is, again, nothing new, but it's good to keep in mind. First lactation animals have a much thinner fat pad comparing to older cows. So that's another reason we really need to look after these first lactation animals and manage them really well. We did have some big differences between the 4 farms, and I don't know why. I just share this as an interesting information, but we don't know which aspects of the farm management led to these big differences. And we also saw in first lactation animals, the ones that went on to develop, this line is the ones that went on to develop a sole ulcer, had a much bigger drop in their fat pad at calving. Am I okay with time, Daniel? Maybe give me a shout when, yeah. So another thing that we're very interested in is the role of inflammation. And an idea is that inflammation, especially around calving, may affect here this attachment of the pedal bone, but it may also lead to pedal bone changes. As part of this study, we found that cows that had a clinical mastitis incidence in the first month after calving were a lot more likely to develop a sole ulcer in early lactation. So one possible explanation is that this systemic inflammation may have an impact within the claw. Looking at our, currently this is just very like lazily thrown there. We're just looking at these results, but we have taken a lot of blood samples from the same study, and we do pick that an increase in one of these pro-inflammatory cytokines immediately after calving is associated with this development of sol lesions. And there is some really cool work from the University of Nottingham with James Wilson leading it, where they did a randomized trial and had split first lactation animals on a farm in 4 different groups. And I do pay attention to this group that got what I call the full treatment. So they were trimmed when lame on mobility scoring. They would get a 3-day course of nonsteroidals when lame, and they would also get a 3-day course of nonsteroidals at calving. Comparing to all these other groups that would not get this full treatment, so this group, for example, would only get the trim when lame and no nonsteroidals. They followed them for their whole life, and you can really see a big difference. So this group, this is their probability of becoming lame throughout this follow-up period that was, I think, like 3 or 4 years. There is a big difference in the probability of these animals going lame comparing to the ones that were not getting this full treatment. So managing inflammation when lame and possibly around calving is probably really important. And another thing that came out of our study, and I've done this before when I was in the States, and we know that really well, but it's still, I think, really important to hammer this message, to really keep this in mind. Once you get a lesion, you're kind of like screwed up then for life. You keep getting it back. You are at increased risk. This is from my Cornell study. If you had a sol ulcer in your first lactation, you were almost 4 times more likely to have it again in your second lactation. The same comes up in our current study, and that's a really nice study, again from Nottingham, Ruben Newsom, looking at pedal bones of cows that have chronic lameness, and the changes here, like the pedal bone, every time they go through these lesions, there are permanent changes within the pedal bone. The fat pad also gets messed up, so I think once you get these lesions, then you're always at higher risk of getting them again. So that's something else to keep in mind. Do I have time for that, or should I? I'll just do it very quickly. I did say I will not include genetics in this talk, but we have done a lot on genetics. Let's just go very quickly to what we did with our genetics work. In this population, we had genotyped the animals, so we knew we could get all the information about their genetics. We did so, doing this, we did show that both these lesions are very heritable. In our study, because we have really good records, the heritability of these lesions is like 30–35%, which suggests that genetics is a big part of it. And to validate this, to see how this works in practice, in real life, we got the current genetic evaluations for lameness. So in the UK, we have a lameness genetic evaluation, which is based on farmers' lameness records. Not the best records, but it's still lots and lots of data feeding into this. And just quickly to show you what we get, this is the genetic evaluation, the information we would get from the genotypes. Negative is bad genetics, positive is good genetics. This is what we actually saw on our cows when we picked their feet up throughout our study. So what you can see consistently, the bad genetics cows were getting more bruising across all the farms. They were getting more sol ulcers. This farm was better than this farm in sol ulcers, but the genetics would still... So to be honest, this farm that was well managed, most of the sol ulcers was down to the bad genetics. So, and that brings me to the end of my talk, and just some main conclusions. As I said, this is very multifactorial. It's a lot we need to consider. I picked some of the things we are doing at the moment. There is more to it, but if I am to take some conclusions based on this talk and our research, prevention is probably the most important thing, because we need to keep in mind, once they get the lesion, they keep getting it back again and again. There is permanent damage. And that's why we need to focus on first lactation animals. Among other things, they have thinner distal cushions. Managing the transition cow, we saw how we get most of these lesions in early lactation, so how we manage our transition cows is really important. Respecting the sole thickness is really important based on our results. I think we already talked a lot about it. If there is a way to know that we kept it to at least 7, 8 millimeters, that's probably going to help. Think about inflammation and how we manage inflammation at lameness events, especially with first lactation animals, their first events, or even around calving if we look at the results from Nottingham. And don't ignore genetic evaluations. In Spain, I think there is pretty good lameness data feeding into the genetic evaluations. In the UK, we can select for the lameness advantage. Other countries have their own, and I think it adds a lot to the whole management of these lesions. I'm sorry if I did run a little bit over time, but thank you very much for listening. And I thank all these collaborators that make this work possible. Thank you.
Hey. Thank you, George. Do you have any question? One question for George? There? 1 second, John, because if not, simultaneous translation cannot.
Thank you for the presentation. I've got a question. The sole thickness research, is it done on cows who were walking on concrete?
Yes.
Okay.
Yeah, all these cows were on concrete, yeah.
And is that another thing when they walk on rubber? Is it other values then? Or?
We didn't have cows on rubber mats in this study. This will obviously make a difference on the wear. So part of what we saw on sole thickness could have to do with the overwear when they walk on concrete. Part of it has to do with how we trim them. So one of the measurements at drying off was done immediately after trimming. So this sole thickness is really down to how the cow was trimmed. The post-calving one was couple of months after the cow was trimmed, so it also has to do with how much wear we may have there. So on concretes where they walk long distances, this may obviously have an impact on the sole thickness. Including if you are on sand, we know that you may get even more wear. So that's definitely something to think about. If you are on rubber mats, you'll probably have less wear, so you may keep more sole thickness there. In this case, you may want to manage the overgrowth and the balance, but based on our results, it does seem that keeping quite a bit of sole thickness there is really useful. So therefore, maybe using rubber matting, at least in the high traffic areas, could help towards this.
Yeah, so the 7 millimeters is for concrete and also for rubber the same?
I would think that, well, I don't know actually if these results would also be the same on rubber, on farms that have a lot of rubber, because I haven't done that. Yeah, okay. If that's the question, whether the sole thickness is as important. Yeah.
Okay, thank you.
Okay. Sometimes 60 days heifers after calving, I see some severe sole lesions. How can we prevent that? Is it genetically, you think? It is,
Oh, my slides are not there, but we saw exactly the same thing, and it's very common that first lactation animals will have a lot of this bruising, this hemorrhage in early lactation. I don't think it's just genetics. A lot of it is how you manage your first lactation animals, I think. It's because they have a thinner fat pad, excessive standing times when you mix them with older cows, especially. We will talk about some of these things in the transition cow workshop. first lactation animals, if they mix with older cows, they may be more likely to spend more time running around and standing and being bullied. So that could be one factor. It's also the first time they go through the stress of calving, which we know is a major risk factor for the development, this pedal bone drop. So these animals are going through that for the first time. What we saw in our study is that we had 2 of our farms, the graph I showed with the farms, we had 70% of the first lactation animals with bruising in one farm, and in another farm we had 20%. A small part of this could be down to their genetics, but a big part of this was management decisions. The farms that had very low bruising in their heifers, they had a heifers group, so the whole first lactation, they were not mixing with the older cows. They were on deep sand bedding, lots of space, lots of feed barrier space, very good management of calving and their transition period. So I think these are the main reasons. I'm not 100% sure, but I think in our case that was the main thing.
And if you say the fat thickness, how the body condition score, how much should it be?
Well, in our our studies, the link between the fat pad and the condition score is a bit weaker than we thought it was. So I don't think it's as huge, but if we add the condition score there, we don't want, I think, and I think Laura Randall is here, and she has done some really nice work there. I think we shouldn't drop below 2.5 of condition. If you're using the same 1 to 5 scale, I would say ideally keep them 275-3, so well-conditioned, not really fat, but avoid getting them too thin. I would add that then in the mix, yeah.
I want to introduce our next speaker. I personally want to do that, even though I'm not being anymore in the organization of this event because I'm getting retired of all these things, but I probably you shall me see again, even if getting retired. That is Richard Touret. For me, it's an important person. He's an adventurer. He's a really improver. He likes doing things in a difficult place. He decided to take the difficult way that was streaming by being a vet in Portugal, where traditionally it was not a reputed profession. It was poorly paid, but with the years, he has become not just an expert, but he's making his life in a proper way. And he has found a place where to work that is very interesting, and that's what about he's talking to us, that are the beef animals, the big bulls, that require very special treatment, but that's him who is explaining to you.
So, good morning. Thank you, Adrian. I was not expecting that. Very grateful to ANKA Podol. So, it was my first step coming across with ANKA Podol 13 years ago. I'm Richard. I come with my team, Elisa, Paulo, and Ellen. And today I will try to show you some ideas about how we manage and how we custom and how we customize how we tune our crush so everything goes as smoothly as possible. Okay, 13 years ago, yes, in Portugal, the majority of my friends told me I was crazy for doing that, going specifically doing hoof trimming. Luckily enough, I had my wife with a different opinion, and I also came across with ANKA Podol. So thank you, and I'm very happy to be here today. So, my first contact was earlier than that, with hoof care, with mobility, with the importance of trimming. It was in my final internship in Terceira Island. For those of you that doesn't know, there's these 9 islands in Portugal in the middle of Atlantic, and the management there is a little bit like in New Zealand, but smaller herds, okay? And yes, I understood that mobility and hoof care is very important, but also I came across with very important limitation, that was immobilization, okay? There was not a lot of resources available at that time. And when you speak about meat herds, can you put this one, Luis? You get the whole spectrum of clients, okay? You have a bull like Manjerico. It's very tame. You can do everything you want with him. You don't need a crush to expect the food. And put the other one. And then you, a lot of times, come across with these cows that obviously need a hoof trim, but they don't seem that interested in doing it because they are animals that roam free almost all year round, and they only come to the crush very little time, so it's very difficult sometimes to manage to arrive to the food, okay? So luckily for us, crushes evolved, and virtually every animal can be very easily and very rapidly, very safely immobilized. Okay, I will try to discuss some topics. For some of you that work with this may seem obvious, but I will try to organize a little bit my ideas here. So immobilization is key. We have to do tunneling, we have to be silent, we have to be very firm and very calm, and we have to make sure our crush has conditions to easy untangle sometimes, especially with the animals with horns. Okay, can you play those from the right at the same time? Okay, what do I mean about tunneling? It's like with dairy herds, okay? We have to make sure that there's as less destruction as possible, okay? One of my most important investments was to panel the barriers. Seems more difficult to wash and everything to put on, but it really pays off because the animal gets really concentrated and going for the front. Also, we additionally use some metal plates to make some more tunneling, but also to protect some hydraulics and some electric parts of the crush. That it's important, especially with the bulls with horns. And additionally, I will tell you in a while, we put another simple panel in the lateral parts, so we get additional tunneling. So, silence. Avoid unnecessary sounds. And sometimes we can use sounds that seem to us that are interesting to make, but for the animals, the majority of time, they are not, okay? It's better to be quiet in silence. If you want to say something to the animal, keep it for when it exits, and it will be better, okay? We speak with our body language, okay? That way we can take advantage of the animal's nature and we can command it very easily. Another thing is a lesson that a lot of us already learned in 2014 with Gerard Kramer, that told us if you want to go fast, think last. Being last, location, angle, speed, timing, okay? With every animal, again, we have to enter its pressure zone with the timing, with the proper speed, okay? And it really helps things going smooth. And of course, with untangling, we have a lot of bulls with horns in the southern parts of Portugal, and no one wants to immobilize an animal like that because you have a lot of work untangling. So one thing you can do, can you play this one, Luis? Is to put these special marine carabiners that are really easy to put and to release with just one hand in the belly bands. And also, if you don't want to take any chance, you can take off one side, okay? And you will have less problems because the bull enters, and even if he gets tangled with the belly bands, it's very easy to pass them over and to correct the position and to tangle them again. So you will be immobilizing every kind of animals. Okay, and the end result is this. Luis, can you put this? Okay, one thing that I forget to mention, it's very important, as we do with dairy herds, it's to create a little bit of anxiety, okay? When we are arriving to the farm, generally we phone the farmer and he puts the bull or the cows or the animals waiting, because it really creates when you're in a waiting room, okay? It creates an anxiety, and when you arrive, you mount your crush, you put your barriers, and the animal very easily is more prone to go inside, okay? For instance, here we use very light PVC panels. You just want to create an illusion there. It's not necessary to have a very tighten or very strong structure. Very light. Can you put the other one, Luis? And also here, I just opened the door. Paulo and Ellen are one in each side, and he already enters smoothly. Okay? We use aluminum barriers, so everything is really easy to dismount and mount in every animal. So may seem a little bit of work for you, but it's the way to really create conditions so we go as smoothly as possible. And then I will talk about a little bit about special cases. Do you think it will fit? This bull is about 1,500 kilos. Well, to our advantage, generally these animals are animals for fairs, okay, for shows. So they are really very domesticated and they go easily. Because if this animal was an animal that roams freely all year round with 1,500 kilos, probably we will have no chance to put him in. But yes, he enters quite smoothly. We only have to pay attention to not push him too much with the back gate. You can create some injury in the nerves or in the joints. Also, one thing that we like to do is to switch the carabiners of the belly bands. Yes, because sometimes aluminium they don't hold. And also, unlike cows, we prefer to immobilize each leg. We restrain each leg at a time because sometimes it's not the weight. The ANKA crash, I believe, you can put an elephant inside because it will go up. The problem there is more create some lesion by manipulation. And these kind of animals, can you play this one, Luis? Quite often, the problem is not getting in, okay? It's getting out. Because, I don't know, they stay there like 5, 15, 20 minutes inside, and they feel like sardines in a can. So I like the ANKA crash because as this option, and it's very useful in those situations. Can you play that one again? So the animal gets out immediately, okay? So with small animals, you can do it also. We do really small animals, and the problem in these cases is really volume. And two things. We should put always these panels because these animals are generally less accustomed to come to the crash, and they are very nervous, and they easily go sideways, okay, for one or other side. So put extra panels. Also, one trick is to lower the back gate so the animal gets its head really low to concentrate in getting in front. And one thing that we had problem is that frequently these animals would fall off, okay? So you might take precautions, and you can tie his head in front or have some person holding his head while he's inside, okay? So he doesn't fall off. Okay, can you put this one, Luis? With slow hesitant animals, we never prod animals, okay? Prodding an animal is a negative incentive. You can get a lot of reactions. He can go in front. He can have the contrary reaction. So generally, we try to use, can you put it again? Positive incentive. We tried with this one. She doesn't look very interested. So in those cases, can you put this one? We winch the cow, okay? Very easily. We calmly bring the cow, okay? Because there's one thing also that is important. You have to make sure that this is as most not positive, but it's not the least traumatic experience for the animal. Because these animals, for instance, this is a guy that has purebred limousine cows. you will go there and go there and go there again. If you start prodding, next time it will be a lot more difficult to put the animal in. And it's really easy. I don't know if you know this technique. I didn't know. Paulo brought it from Brazil. You just put a rope around his neck and another lace, and you put the lace in front, and she's off to go. She can be pushed securely without no problem, okay? Sorry? Oh, yeah. We can show you in the afternoon if you'd like. Paulo will show you. Yes, can you play the video in the right? Yeah, you just put a rope around the neck, and then you make a lace and go behind the first lace, and you put it in front of the nostril, and there you go. It's completely safe. It will never hang the animal, okay? Okay. Well, in the other end of the spectrum of beef-furred animals, we have Manjerico, and then we have these animals. Can you put this video, Luis, please? And this is a different kind of animal, okay? So I never sedate aggressive animals, also because these are Toro de Lidia, bullfight bulls. And generally the owners, they are really very nervous with sedating or getting anesthesia with these animals. So it's a problem. Also because if you want to put an animal like this, sedated in the crush, there's a very high probability he's going to fall off, and it's the worst that can happen. So what we generally do, it's not very often, but is we don't sedate, we bring them with we are hidden here, we don't introduce ourselves, because these animals are ferocious. This is not a very aggressive animal, no, they are ferocious, okay? And we put 2-3 animals in their own crush, and we put the last one that we want to trim in the last place very quickly. We have 2 persons with ropes, we tie them in both sides, and we give him an old-fashioned trim with pincers and hoof knife as quickly as I can, and we go. Yeah. And also, I would say I wouldn't put a bull like this in an ANKA. I like very much my crush. I will need it the next day. I don't have time to go to the workshop. And you get a happy customer as well, okay? Now, it's important when you're working with beef herds. Can you put the first one, Luis? The upper left one. To check its mobility prior to enter the crush, okay? Like in this case, you go behind the bull, he's severely lame. You can hear his joints clicking, okay? He's very, very severe lame, this one. They're young bulls, okay? So the owner has expectations, but in these situations, I have a problem because this video. So this one has hip dislocation, this one has a fracture in the pastern, okay? That video shouldn't be there because we would need to see the two that are. Wait, just a minute. Can you remove that video? Because it should fall from. So it is another situation that I only came across once. I would like to show you. Okay, perfect. Can you play first one? Okay, look at this video and try to see it in his right side. The other one, please, Luis. So he was going down, now he's going up. Look to the right side. So what do you think? Would you put any of these animals in the crush? After a bit of discussion with several vets, the most consensual opinion was that bull that is new, is relatively new, 3 years old, had a stroke because he has impaired mobility just from the right side, okay? So with animals like this, I don't put them inside the crush, okay? Because probably you will aggravate already a severe condition, and it doesn't need a trim. You can do a very nice trim. For instance, he had long feet, that bull on the right, but it's pointless, okay? So what do we get when lifting beefle cat feet? Long and really long hoofs, okay? In my opinion, is the worst problem that we have, because when we have long hoofs, we have the consequences that come with it, okay, also, okay? Then we have usual lesions, disruption hoof horn lesions, like George talks about, white lines, sole ulcers, toe ulcers, digital dermatitis that also starts to be, we can see on the beef herds, but it's mainly an hygiene problem. Foot rot that generally also is related. It's quite often, okay, because it has to do with the trauma of the interdigital space. In that case, you can see that it was barbed wire that entered the interdigital cleft and made an injury that then infects, okay? And then you have other lesions that somewhat are more frequent in beef herds, at least in our conditions in the southern plains of Portugal. Namely, corkscrew claw or PT irritation, teloma is quite frequently. Well, I don't know how frequent it is because they call us to treat them. But overall, I don't know if it is frequent, okay? Sand cracks and soft fractures, okay? It's quite common also because in Alentejo, we have really dry, really arid, really hot conditions in the summer, and I think it's the most important risk factor that we have in Alentejo. And then we also have quite frequently perforations, because in the field you have, for instance, abandoned wires, you have nails that were used to make the fences, and sometimes they perforate and make these lesions that we know that are sometimes difficult to cure, okay? Well, therapeutic guidelines. I don't have nothing new to tell you, okay? Blocks as much as possible, as big as possible. I think in this situation, size matters, okay? As big as you can. I will come again about this one in a minute. And also, it's nice to have other solutions in your toolbox, like these TP blocks. They really are long-lasting, and they don't deform, they don't wear off. And sometimes when we anticipate a very long, difficult lesion to cure, we use them. And also other solutions like the iron block to use in animals that have both claws involved, okay? It's really useful, okay? Blocks, 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 stable, comfortable, long-lasting. Make sure you apply the block as best possible, okay? Then, with blocks, you also have an important thing to do that we spend a lot of time, okay? First intervention, we try to wash and to remove as much as dead tissue. We try to control the infection as much as possible, as severely as possible, so the corian can regenerate. Because we see in the last years that we spend more time cleaning lesions, controlling the infection, our cure rates go up, okay? Then bandages is always that question. You have to understand that these animals sometimes go to the field and then they are not, again, inspected. So maybe you have a bandage to cauterize or to make protections in severe lesions, but we are not very proponents of bandages. And of course, like George said, NSAIDs, non-steroidal anti-inflammatory drugs, are piling evidence that really control inflammation and reduce scar tissue and the growth of the bones, and that snowball effect that George was talking about. Okay, when to trim? Well, we put our cards in preventive, both females and males, before or ending mating season, okay? Bulls shouldn't be trimmed at dry off. If he's dry, he's off to go, okay? And we usually, with our more consistent clients, we do it at the spermogram exam. So what you're saying here, it's all the kind of races of bulls. They are coming. This is a vet team that is making the spermogram examination. And if the bull receives a green light, it comes to the crush. And of course, he will survive the mating season a lot better with a proper trimmed feet, okay? And also with cows, this is for another example. It's us arriving to a farm that already understood, like in dairy herds, the importance of making preventative foot trimming, okay? Those are Charolais purebreds. And this client, for instance, has 400 cows. And from 5, 6, 8 years on, they come every year to trim their feet. So they go as the distance as much as possible. Well, about reactive trimming. It's important to react, but prioritize prevention. I'm already repeating what Josh said, but it's easy to understand. When we correct the shape of the hoof, we take forces from undesirable places, okay? Luis, that video is also hiding something I would like to show. That one. Okay. Well, this is other condition that sometimes happens. That long feet in the summer, when the toes are really, really long and the claws are really, really, really dry and not dry, hard as rock, eh? Hard as rock. You cannot work with a foot knife. It's impossible. It will do this. You have to put the grinder, and we prefer not to do anything in the summer, okay? And what happens it's that I have images behind. Can we do like the last time, please? So what happens is when these conditions, they all come together, extremely dry, extremely hot, extremely hard surface, the hoofs, they break in the toe area, and they give place to those really difficult lesions to heal in the toe area. Okay, so this is what happens, okay? Long feet, it will break, okay? And you trim, and you get those toe ulcers that we know that are really difficult to cure, okay? And this is secondary to a primary condition, that's long feet, okay? So with the white lines is the same, okay? As you can imagine. So, more than hoofs, what I mean with more than hoofs? It's when you have a bull inside, or a cow, you take the opportunity to inspect the whole animal, okay? Because you add value to your service, okay? Generally, to the bulls, we inspect the testicles. For instance, here's quite clear asymmetry. We check for lesions in the penis. We do a little trimming also there. And then you can add a lot of very easy to check health points. Ox and crotch, these lesions are really, really painful also, and sometimes can motivate lameness. Skin lesions and lacerations, eye medications. We can take advantage also having the animal immobilized to saw a horn there. It's already damaging the skull. And when you have time to do a little bit of aesthetics, okay, but only for very special clients. Okay, why may you think? Why do I dedicate myself to looking for this animal? Because I think it's a good way to be accountable, okay, to have a little bit of good relation with your clients, okay? You add value to your service. Okay, I will go to some examples now. This is a bull. There's kneeled, okay? He cannot go up. The story of this bull is it was a really expensive bull that went to one farm to another. His name was Damian, and he couldn't stare on his front feet, okay? Not because he was abandoned. This animal, the story was he had a reticulopericarditis, and the vet told the owner to shot him, okay? But the owner was not happy, and he continued to administer quantities of oxytetracycline and anti-inflammatory drugs, and he survived, okay? So then he couldn't stand. So we went, we do a little trimming, and sometimes we have these things. It almost seems like a miracle, but no, all it took was a little trimming to put the animal back on his feet, okay? Another story, this young fellow, it was a summer day like this, and he is young, and he tried to go for a swim in the irrigation canal. So after a little bit of panic, taking the bull from the irrigation canal, they tried to fish him. Then they tried to convince him to go up the stairs. Doesn't work. And after a little time, well, they resolved we have to conduct them till the next ramp, okay? So they do. Needless to say, he was extremely lame after this adventure. What do you think had happened? I have to take some water. It was extremely lame because he fractured the toes from both front leg. It's that question. Again, they panic a little. They wanted to assist the animal as quickly as possible. They tried to push him to the ramp. And of course, he fractured both front legs, front hoofs, soles. Nothing that a good applied block would not treat, okay? Another example, this bull was already 5-6 years old, no big complaint. Sometimes farmers say, oh no, he's not very lame, he just needs a correction. And we start to trim it, and we find this very big abscess in the apical area, already with P3 partially dissolved, okay? Luckily enough, we applied the block, in this case a easy block. We see that the corium is preserved, okay? Remove all accident necrotic material. This is the client that sent me a photo 60 days after, and this is 2 months after, okay? So I think we can almost speak about a kind of hoof plasticity, okay? The hoof is a really regenerative tissue, okay? Okay, I'm okay. Okay, I would describe a little bit how we proceed with teloma, but if I want, okay. Okay, just to mention that with teloma, I would describe the technique, but there's no time. We use these uterine clamps without the rubber pads to have better grip on the teloma. And can you put the video, Luis, please? And it's very easy to remove it because you have both hands, this one. Both hands free, and you can do a very clean job with only 2 blows, okay? Then sometimes we cauterize it, sometimes not. I will go with more speed. So this was just to demonstrate that we have very good prognosis with teloma, okay? This is another case, a more severe one, an Angus bull. We remove it with the technique that I was talking about. And this is this evolution. So just to say that if you don't have this animal, when the teloma is really very huge and implanted in the pastern region, in those other conditions, when it's like a golf ball between the toes, you have really good cure rates, okay? Não tenho mais tempo? Okay. Okay, just, okay. Maybe another time. Okay, this was just to tell what George said, okay? Yes, I think that's some kind of hoof plasticity, okay, of the feet, but an animal that has a problem in the hoof will be a frequent flyer, okay, to our crush. Okay, take home messages. slow is smooth and fast. I think it's a phrase that encapsulates well what I tried to tell you about conducting animals to the crush. Immobilization is a service, charge for it. So we have this crush, we have all this situation, okay, in place, but we have to understand that before charging for our service as trimmers, we have to charge for the immobilization. Itself, it's a service, and a very important one, okay? Secure, block, and control pain and infection, already talked about it. And trimming, animal checkup, mobility and health. I think hoof trimmers have really good, important role to play, okay? I think that we can be very good health auditors, okay? So just to finalize, that we show this one. Why, anyone guess why we made this block? Yes, for a giraffe, an African cow. It's like a cow, but from Africa. We didn't use the ANKA. We took 20% to immobilize an animal like that. I still preferred ANKA 95 times. Also, when you need, can you put the video? To make sure your client gets his bus on time, okay? Thank you.
I'm making you a question regarding in the picture you said about the interventions. Some cows you don't put in the crush, you put in the crush. You mentioned the foot rod, interdigital phlegmon. If you have a clear diagnosis before putting in the crush that it's an interdigital phlegmon, should you put in the crush or just put some parenteral antibiotic treatment?
Well, those cows have to be injected as soon as possible, okay? And I think, yes, it's always useful to take them to the crush and to do something more, again, to remove all the necrotic tissue that sometimes, or a lot of times, the foot rot involves. And as to making intravenous regional antibiotic therapy, generally I don't do it. Because in beef herd animals, the skin is a lot thicker and it's more difficult to cauterize a vein, but just because of that, okay?
I don't know what to say to Dörte because she's the queen of digital dermatitis. I think everything that I can explain about her, for sure that I am underestimating her CV. I don't think that anybody in this room doesn't know Dörte. Everyone studied the MHAs from Dörte, and I think in every research-related dermatitis in one way or another, Dörte was involved. So, yes, I leave you in the best hands that I can leave this presentation. She's going to make 2 presentations in a row for half an hour each one. And Dörte, the floor is yours. Thank you.
Thank you, Daniel. Thank you, ANKA, for the invitation. Believe me, I would have loved to be there today. I apologize for having to do this online. I will talk slowly because I can hear an echo in my audio, but that's just a big group interacting with matters in this boxing. I hope that you are enjoying Spain and the venue. I see people coming inside and sitting down, and I was asked to say something about long-term strategies to prevent and control digital dermatitis in cattle. So I will just proceed, and I just want to check the time. I was allotted 2 times 30 minutes, so I'll be on time. And let me see. Here we go. So now my clock is working as well. Well, welcome. I want to focus today on long-term strategies to prevent and control digital dermatitis in cattle because we are very much often focused on short-term gain and effect of influencing skin that is very much inflamed and very much affected by huge clouds of very diverse microbes, bacteria, fungi, viruses. Everything is on top of those digital dermatitis lesions. people are thinking about wound healing and biofilm formation and how to influence that. But at the end of the day, we're talking about an infectious disease that seems to be spreading through our cattle populations. And I strongly believe that we have to think more long-term about what we do when it comes to preventing and controlling digital dermatitis. My name is Dörte Döpfer, and I don't consider myself a queen at all. The reason why I'm not with you is family. We almost lost my son twice during the past weeks, and so there was no way for me to leave. Then I had to leave because of another family problem in Germany. And I'm just back. Last night I returned from Germany. So for me, this is still Euro time, and it's not too painful to be up early because of jet lag. Okay, half an hour to talk to you about long-term strategy to prevent and control DD. You have to think that we are facing these ulcerative lesions at the skin-horn border. I don't know, can you see my pointer at all, or I will do this without pointer? Okay, so you're looking at 3 pictures of different DD lesions, and these active acute lesions, I call them M2 lesions, and I will talk about the M stages again. Believe me, I'm not married to M2 lesions. George always says, like, Dörte is in the room, be careful what you say. That's not the case. I'm a very peaceful person at heart. But when you face these lesions and you're focused on how to possibly treat them, how to rat feed and then assess them later or not assess them, you have to think about these lesions as the barrier between the outside world and the inside of the cow. So whatever goes on top of these lesions will end up to a degree inside of the cow, and whatever you are applying to the skin that is altered here, you can tell that a wound like this is different from intact skin. Whatever you apply here is going to influence that skin at the same time, which is why the prognosis, the effect of your topical treatment, of your locally applied treatment agents will be different based on the history of the cow. And to the left, you see a young heifer that is experiencing this disease for the first time at the skin-horn border. And if you apply a topical treatment here, let's say a chelated copper gel would be enough to transform this into a lesion that is not healed completely. The skin returning from treating a lesion like this will not be perfect. And at this moment, I just want to recognize the translators as well. I'm trying to speak slowly because I was not able to provide my slides in advance because of my family issues. So thank you, translators, for trying to follow along, and I will try to speak slowly. So this heifer is experiencing the lesion for the first time. If I apply a relatively mild disinfectant after cleaning it, this animal should be all right in terms of lameness. She will probably keep DD for the rest of her life. It's very seldom that after repeated treatment that the skin will return normal, and that by PCR, by laboratory testing, you cannot detect any of the associated bacteria such as the treponemes within the skin or on top of the skin after topical treatment. It's the exception. Today, increasingly, what we're seeing are lesions like in the middle or to the right, where we are not talking only about an ulcer. We're talking about an ulceration of the skin on top of modified skin. So here the skin environment barrier is modified to a degree that is different from the skin on the left-hand side. And the microbiome, so the clouds of bacteria that are on top of the middle lesions actually are different from the ones on the left. At the same time, the genetic makeup of the cow that makes these big wart-like lesions, as you can see in the middle and to the right, the genetic makeup is different. There is a genetic predisposition for dairy cattle and beef cattle, by the way, to produce these chronic wart-like lesions. We call them proliferations because the resulting pedestal of skin actually is raised above the normal level of the outer skin. In the middle picture, what you can see as well is that there are chronic consequences of digital dermatitis because of the coming and going, the cycle of these lesions. So because we are talking about the localization, mostly 95+% of all lesions are occurring in the hind feet. And because of the location at the skin-horn border, what you can see is that the horn formation of the heel horn is disturbed. We see an overly high heel horn formation, as the heels are very high. We see heel horn erosion in layers because of the cyclic nature of the reappearance of these lesions. So, and we actually, in the long term, we see sole ulcers because of the mechanical malfunctioning of this horn. So we see sole ulcers, we see wall abscesses, axial wall abscesses. We see the abraded toe tips that you know from chronic lesions, also animals chronically affected. We see lesions that are not in the typical foot localization. We see lesions in front of the udder, in the knee fold, on hocks, on teeth bases. So digital dermatitis has many more consequences than we realize if we are focused on it only in a short-term type of situation. And I think we have not even begun to truly estimate the economic impact that this disease has on our cattle populations. Many producers are resigned to the fact that, well, at some point she's going to get digital dermatitis. And I truly believe that this awareness has to change. This resignation has to change because, and it is changing. It is due to the impact of people like you, the fellow hoof trimmers, that the awareness is changing. I'm thinking about Jamie Sullivan, who's probably somewhere in the room, who comes home and says, I wrapped 100 feet. I don't want to waste my time on doing that. And that's why we have to talk about the role of chronic reservoirs being these callus and wart-like structures that are signs of chronicity. We have to train ourselves, and I would have loved to do this myself today with you in the workshop. I have a decision tree where you decide about, is there chronicity, are there signs of chronic lesions, and then depending on what you decide about these different stages, you have to customize, in my opinion, your interventions, being preventive or curative, however you like to do that. So in summary, for this slide, the message is not all of these lesions are equal. They need different approaches towards individual therapy, and they will need different approaches when it comes to preventing them. And our focus on prevention of digital dermatitis is key. And this should include a genetic test in the not too far future. I'm thinking about Kati, who's in the room, colleague from Poland, who's an advocate of being aware of genetic predispositions for any disease, I would assume, but DD in particular. So we have to be focusing not only on frantically detecting a lesion and treating them all the same. We have to be systematic about it. We have to have time periods during which we do this, like once per week, once per day, several times per day. And I'm going to talk about how we use artificial intelligence to support the early systematic detection of these lesions and the typing of the cows, the typing of the lesions, using computer vision models. And that's going to be the subject of my second talk. So from here, I'm going to go into long-term versus short-term prevention and control of digital dermatitis, and why even bother? I'm one slide further now, Luis, and you're so focused on the short-term interactions of our treatment agents. Would you be so kind to switch the screen again so I can show my writing? I can keep smiling, I can try to be alive, but there's something about showing some pictures. Hello, are you alive? Ah, thank you. Okay, I can see the screen. I can see a person walking towards the screen. Awesome. So we are so focused on short-term interactions of our treatment agents with, and I showed you different lesions. These are skin tissues. They are severely inflamed. There's inflammation going on, not only on the surface, but up to deep down into the tissues themselves. So that's not only the surface of the tissue, but it's deep down into the dermis and signals inflammation to the entire cow. So these tissues, the skin that has the wounds is covered in clouds of microbes, and people are calling them biofilms. But then we are treating them with disinfectants, with antimicrobials. In some countries, that's not allowed anymore, and that's a good thing. We're treating them with anti-inflammatory drugs, so we're interfering with the pain management, with the inflammation management of the cow herself. We are applying immunomodulating feed supplements that are able to significantly delay the emergence of digital dermatitis lesions. At this point, I want to acknowledge the continuous support by Diamond V and Cargill. I want to say that there are feed supplements that strengthen the skin barrier. At this point, I want to acknowledge the continuous support over all these years by Simpro. Although I have no commercial interest in all of this, there are people and companies who think along to make these short-term interactions of DD lesions with our treatment agents more efficient. And then there are other treatment agents that are possibly extremely acid or extremely basic. And you can imagine how this interacts with inflammation. It has severe consequences for how the skin reacts to treatment. So whatever you apply to those skin environmental barriers, to that severely inflamed skin, be aware you would not want to apply anything to those lesions that you don't apply to a wound on your own skin, or you face the consequences of chronic DD lesions. And our topical treatments are failing us, depending on the history of the cow with regards to repeated DD lesions. So we need to aim for and act when it comes to therapy of these lesions based on the history of the cows, based on the history and dynamics of the groups of cows that we deal with, because not all DD lesions are equal. And I will go to the next slide. Yep, okay. So topical treatments are failing us. And one of my key messages is that all we can expect from a topical treatment, the best thing that we can expect is that we get this foot into a stage where a foot bath, a preventing, disinfecting, biocidal foot bath will actually continue that job of keeping the foot and the lesion in a corner of the dynamics of DD that is acceptable in terms of animal welfare, prevents lameness, prevents from recurrence, and prevents from having these huge proliferations, the wart-like stages of digital dermatitis. So another thing that I keep advocating is, if we continue applying these extremely caustic treatment and foot bathing agents, if we keep applying them to the surface of these very inflamed feet, we are, as hoof health managers and hoof trimmers, as veterinarians, as nutritionists, we are part of causing and evoking big problems. There's no reason to be as caustic when it comes to therapy and prevention of DD as I've been witnessing for many years now. Because if you apply topical treatment, as it said on this slide, if you apply topical treatment for the short-term gain, in the long term, you're going to have failing of your prevention program, because the feet are often released into the same environment, including the infectious pressure from other cows that are affected. You have to imagine that each and every lesion that touches the floor is going to leave a stamp of infectious material in the environment. And we know that treponemes that are causally associated with DD, they survive up to 3 to, if not more, months in moist and dark environments. If I have treponemes on my skin, which I actually do, but they're of the different kind compared to DD, But if I leave them in the environment within a couple of minutes, let's say 30 minutes under the influence of oxygen and UV light, these microbes die immediately. And there are not many antimicrobial resistance factors that are really associated with treponins in our context. So it's not a matter that our treatment agents don't kill the bacteria that are associated with DD. It is that these bacteria are able to hide deep inside of these chronic lesions and of affected skin, DD-affected skin. And if they hide, then whatever we do in the short term on top of these lesions will not reach deep down into the skin and affect any of these hiding, actually hibernating treponins. And at the same time, even after caustic treatment, we are releasing the feet into the same environment, including this infectious pressure, including the trimming problems. I'm talking about over trimming of these feet. So on the one hand side, you get overgrown heels that are too high. On the other hand side, you have trimming experts, so-called experts, that over trim those feet and lower the heels a lot. And then these animals are released into environments where the walking surfaces are not optimal. They make sudden turns, sudden breaks, and from the shearing forces applied or impacting the skin between the claws, the interdigital skin, you obtain micro trauma through herding problems. So if I push my cows a lot, they're very nervous, they make sudden breaks or make sudden turns, then that micro trauma actually to the skin is a way of entry for more bacteria and complications regarding digital dermatitis and other claw diseases, by the way. So this conjunction of the environment being infectious pressure, the trimming problems, the hygiene problems, because many of the environments of cows today are not optimal with regards to hygiene. All of that together with the human factor of how we herd and treat our cows while we are interacting with them, this all leads to the emergence of more of these lesions. So we as humans, we are part of this problem, particularly in the long term. The more we focus on short-term effect of some magic portion that is usually problematic with regards to interacting with inflamed skin, the more we are focused on short-term interaction only, and for cosmetic reasons, we want to get the skin covered into some form of stage that, or a scab that seems to be healing. We have to be aware the best we can achieve with any topical treatment is that the lesion goes into a condition where we can follow up with a customized and strategic foot bath. So not all of these lesions are equal. The prognosis or the effect of any treatment upon these different lesions. Okay, I think you do not see me. Okay, then I keep talking. The effect of these treatments is different, and we have to be aware of the history of the cow if we want to assess what is our best prospect when it comes to treatment. So putting this all together, if we focus on the short-term interactions, we have to be aware of all these so-called treatment agents and how acid or basic they are. We know the more acid, so the lower the pH, the more the propensity for producing chronic lesions, the wart-like proliferative lesions. Our treatments are failing, so even with the best topical treatment, we have failure of disease, failure of treatment, and that's partially due to the genetic component that is associated with chronic DD. And if we don't interact with herdsmen and the environment of these cows, then whatever we do for treating and preventing the DD, we will not succeed because there are these infectious pressures, the hygiene problems, and the herding problems. If we push our cows too much, that adds to the risk factors with regards to the emergence of digital dermatitis. And low stress stockmanship and cattle, I think, are part of the animal welfare. In my case, we are using the mechanically induced heel horn flaps to count how many cows are suffering from them and to assess in the welfare scoring how well are they doing when it comes to the herding interactions with these cows, because the more of the mechanically induced heel horn flaps, the more somebody is pushing these cows, and that can be avoided by good training with regards to low stress stockmanship. So you've seen this, or many of you have seen this before. We make this distinction between the healthy skin called, and the M stages. M stands for Mortellaro, and at this point I want to send out a shout out to Carlo Maria Mortellaro. I saw Loris De Vecchis walking in the room somewhere, so please say hi to him. Carlo is still doing well. And the M stage, one morning in 1991, I think, during my master's thesis, we looked at sequences of images from cows where we followed them up every other day and then every week. And we discovered some regularities as to, wow, there seems to be healthy skin horn barriers, which we called M0. Then there are these small focal bacterial lysis spots on the skin, particularly in between the claws. We call them M1 because they're smaller than 2 centimeters. Under the impact of environmental factors, those seem to grow out into the M2 stages that are larger than 2 centimeters, larger than a quarter size, larger than a euro coin, if you want. That's in the lower right corner. We call them M2 stages. And then when you treat those topically, what we expect is for them to go into M3s, the healing stage. The healing stage is actually very short-lived, covers the wound in a scab. It's pretty rough scab, and depending on the environment, can be black or it can be green or it can be whitish. Scab falls off about 10 to 12 days later, and what is left are these chronic lesions. And the chronic lesions, they can be a little callus area, an M4 stage with hyperkeratosis, or if you irritate that inflamed skin enough, then you will see a proliferation, this wart-like structure emerging, and within the perimeter of the M4, you will see the M1s emerging, which is a pre-stage for crossing over from M4.1, because we have a chronic stage plus the early stage, that's the M1 plus the M4, and this crosses over into M2s, and this closes the cycle of digital dermatitis. We want to break this cycle, preventing the emergence of the M2 lesions, and we want to break the cycle of recurrence of M2 lesions by using preventive foot bath with biocides. And please, whatever I say about foot bathing chemicals, be aware of the local regulations and the European regulations when it comes to the application of disinfectants and biocides to food-producing animals, including cows' feet. So I'm going to be using the M0s, the M2s, and the M4 stages. And an M4 stage, I will attach an H for being hyperkeratotic and a P for being proliferative. I make a big distinction between these signs of chronicity, and you will see this reappear when I talk you through the different types of cows. So cows have different reactions to the interaction with digital dermatitis. Therefore, we type them at the individual cow level and at the group level, at the farm type level. So an animal, I'm in the upper half of this slide, a cow that has a cow that is of type 1 has no M2 lesions, so no active ulcers during a long period of time. A type 2 cow is the one that has it once and then not reappear for a long time. And the type 3 cow is the one that has these repeated M2 lesions. Every 14 days, she comes back, and whatever you use in terms of topical treatments will not help this cow much. She just keeps cycling through the different M stages and comes back with repeated M2 lesions. It has to be possible to think about culling these cows. Although many producers say, well, she's producing, why would I cull this cow? Well, this cow is propagating the genetic predisposition for chronic DD through your herd, and this cow is transmitting DD through to other herdsmates, particularly as they are in the same environment around risk factors such as bad hygiene, water troughs, walking paths, wherever cows paths or cross paths. This is where DD is transmitted, in my opinion, whenever a herdsman pushes cows to the point where these heel horn flaps actually are being produced, we are increasing the risk for having repeated DD lesions. So much for the typing 1, 2, and 3 for individual cows. And then in the lower half of this slide, you have the farm types, where the farm type 1 has no outbreaks observed over time. And an outbreak I define as about 30% of cows developing new cases of DD, of M2 lesions. Type 2 farms are the ones that have a single outbreak, and you have to do a lot of work to combat this outbreak, but then in the end it is under control, and usually this is followed by a very systematic systematic foot bathing strategy. And then you have your type 3 farms where you have repeated seasonal outbreaks. Those are your problem groups. This is where you obtain the phone calls from farmers saying, like, we're doing everything. What are we doing wrong? We are foot bathing 7 times per week, 3 times per day. The pH of our foot bathing agent is 1.5, and we are spraying them at the exit of the parlor, and still we get all these outbreaks. Sometimes, and this is my message as well, sometimes less is more. So you can, if you are aware of these different cow types and the dynamics of disease with regards to DD, you can actually reduce the effort to something that is customized to the dynamics of DD. How do I do that? If you ask me how to implement a customized hoof bathing strategy, I will start with Monday, Wednesday, Friday of a foot bath. Let's say in my environment, it's a lot of copper sulfate at 2 to 5% and a pH of 3.5 at the beginning of the foot bath being filled. We talk a lot about design of foot bath. We have very narrow foot bathing troughs, but very long ones so that the cows can actually walk through and dunk their feet into that fluid that is about 6 centimeter high twice. We perform pen walks once per week at the moment, or I will show you how we do this for 9,400 cow dairy, where we actually do it continuously using camera models and AI. So I imagine me walking through pens once per week, and I will, the cows are in head gates or in robots where we have cameras and you can look at the images of the feet. And I discover these proliferative M4s. If the number of these wart-like chronic lesions increases, then I know my hoof bathing fluid is too aggressive. That's in the upper right corner, and you get a red, unhappy smiley. If those go up, you know that your foot bathing is too aggressive, and you should consider lowering the frequency in terms of Monday, Wednesday, Friday, or Monday, so all days of the week. You could go back to this Monday, Wednesday, Friday regimen. If you see the number of proliferative lesions go down, you get a green smiley. That's the second from the top. These are the first signs of success. If you see fewer wart-like chronic lesions. And then I often get the question, well, I take my hoof knife and I just cut them out. I'm going to show you why I think that's a bad idea and an unnecessary idea. Of course, you want to clean the lesion, but you don't need to really clean it and scrape it until it starts bleeding. That's just irritation of this chronically inflamed tissue anyways, which results in more proliferation in the long term. In the short term, it might look cute and clean, but in the long term, you will have proliferation aplenty on top of that old lesion. So if I see more of these M4 lesions with proliferation, then I'm unhappy. If I see more active acute ulcerative lesions with that I call M2 lesions, I'm unhappy. I have to think about my detection frequency and efficiency. This is where AI can help. If I see the number of M2 lesions over time during my weekly pen walks go down, I get a green smiley, and I will keep on going with my preventive strategy, manage the risk factors such as my herdsman, my hoof trimmer, my infectious pressure and the hygiene in the barn, and customize my foot bathing strategy accordingly. Comes the day when one day I can afford to swap out the Wednesday, for example, for something that is more sustainable. So before I was using, let's say, copper sulfate formalin, foot baths to break the cycle of DD, but then comes the day when that transmission cycle is broken to the degree where I can't swap out my foot bathing fluid for something that is more sustainable. I'm thinking about a 1% chlorine solution, or some people can withstand with water and soap. And I keep monitoring and hopefully automatically monitoring. Here's the reason why I believe it's a bad idea to cut out those chronic proliferative lesions, the wart-like lesions, because if I do subject my group of cattle to the right dynamics of a foot bathing strategy, actually these chronic proliferative lesions will fall off in DD-associated flaps on their own. So after 3 to 6 weeks of applying the right foot bathing strategy that appeals to the dynamics of DD, you will see these flaps falling on their own. These are not the mechanically induced flaps. These are flaps of dead tissue that just fall off. And very often when I show this type of pictures, people nod and say, yeah, I've seen this happening. But very often, if you keep irritating the chronically affected DD lesions, if you keep irritating them with caustic chemicals, you will not see these flaps forming. On the contrary, the wart-like quality of the surface of the lesions will actually increase. So first good sign of a preventive system, including foot baths and topical treatment, first sign of success is that these flaps of dead tissue fall off the proliferative lesions. I don't need to cut them off. They fall off on their own, is my claim. So now I'm going to put this all together into the herd dynamics of DD. So if we have a type 2 farm, that means this is a farm that has a single outbreak symbolized by, on the right-hand side, after calving, this one red peak of the number of M2 lesions. So if I have a type 2 farm, this started much earlier than the lactation of the cows. So imagine that a heifer is around breeding age, about 12 to 14 months old. And I see this outbreak of DD in the pre-calving heifers, which is symbolized by the peak of the red line in the left-hand side corner, left-hand side of the slide. Then I need to calculate about 60 to 90 days back and start prevention, including disinfecting foot baths in those heifers. And many of these heifers will develop chronic DD after calving. Actually, they are joining a lactating herd. This is the right-hand side of the slide. They will be joining a herd of lactating cows where there is a degree of control. If I am able to continue my prevention and control strategy, then what you will see is that the green line actually will go up, and you have more of these chronic lesions with hyperkeratosis, and the number of M4s with proliferations goes down. Now in the next slide, I'm going to show you what type 3 farms do. There, this peak in the pre-calving heifers around the breeding age of 12 to 14 months, that peak is followed by multiple peaks of multiple outbreaks, symbolizing multiple outbreaks of DD. Here, our prevention strategy seems not to be able to break the cycle and get this under control. And what you will see in the long run is that the number of chronic lesions symbolized by the white line, chronic lesions with proliferation, that is symbolized by the M4P, that will go up. This is the case when my flaps do not fall off the dead tissue. They will just keep proliferating. So the difference between the two is in the type 2 farms, you see in the long run that the number of M4 with hyperkeratosis, this little callus area at the same level as the skin, that goes up. But in the type 3 farms, what will happen in the long term is that you see many, many wart-like chronic lesions. And when we meet one day again, I'll be happy to explain this in more detail. Just be aware that you have these different types of farm dynamics, and the crucial part is to keep monitoring the aspects of the chronic lesions. If you see more warts, you're on the wrong path. If you see flaps falling, you're on the right path, and that's what we want to achieve. So with this, I'm going to take a break. I'm 5 minutes over my allotted time. Daniel, if you would take over for a second. And I was told that there would be a break between the two talks. If not, if you're happy, I will just continue. Hello? Are you still alive? Would you raise your hands if you are alive? Thank you. Hi, everyone. Hi, everyone. I would have loved to watch the summer school and the competition that will follow soon. My husband and I, we were hoping to be in Spain and actually look around Barcelona. So it would have been wonderful. Maybe another time. So unless Daniel stops me, is he sitting in the front row? Could you raise a thumbs up for me to continue? I'll just go, unless he stops me. Here we go. So I want to continue about talking about AI-supported detection. And AI stands not for artificial insemination, it stands for artificial intelligence. And there are so many forms of artificial intelligence today. So it's a moving target, something that I believed was true a year ago. And I just received an email where people are saying, oh, we're going to apply for an award. And we're going to use what you were talking about a year ago, but we're going to consult with somebody else. There's so many conversations like this. I think everybody should do what they're doing, but be responsible about the use of AI and be democratizing AI. So spreading the word is important, in my opinion. Have as many users as possible who have heard about how to critically assess AI-supported systems. And what does this mean now? AI-supported detection of digital dermatitis in our context. Well, we focus on the long-term, systematic and periodic early detection of digital dermatitis lesions. In my case, that would be the M stages, but you can do this at different levels. I know that George has been probably including in his talk with the lameness detection, that there is digital dermatitis detection in the form of a yes-no diagnosis or detection, which is fine. But if you do yes-no type of detection of digital dermatitis, which is an achievement on its own, you will not be able to make strategic decisions about the degree of proliferation, about the flaps falling, about mechanical flaps. All these interactions of the cows with their environment will get lost in translation. So applying these computer vision models, for example, a YOLO model, this can happen in many, many different ways. You can set up your camera in a stationary way, and we use security cameras. We can attach a computer vision model to any IP camera, any stream of a security camera. And this means the monitoring of cows' behavior, of cows' identity, of their pathways, of the interaction is not limited to DD detection. It can be applied to so many different environments. So stationary setups, but then many people, they drive their pickup trucks or quads, their motorcycles, or they ride their horses through cow premises. So they have to have portable, so-called edge devices. And we use microcomputers that we can attach to the stirrups of a cowboy, for example, to monitor and detect DD. And as of last Friday, actually, I can use my phone. I have an app on my phone that can stream for DD. So I don't have to sell you an expensive instrument anymore. No, this is going to go locally. I don't need the cloud anymore. Locally onto my phone. And imagine the training potential for this type of disease detection augmented by AI. So portable devices, phone apps, and cloud-based models. Of course, if you want to shoot your detection, your IP streams from cameras into the cloud, that means to some cloud-based computing system, and get the detection results back, that's possible as well. So computer vision models are meant to catch signals of cattle, and that can be lameness, that can be DD stages, that could be respiratory disease, pink eye, ringworm. There's so many possibilities. Think about early calving sign monitoring. And this is all used, this type of AI systems, they are used to augment human skills in a responsible and ethical way. So here's my second talk. What do I do in order to help people acquire the skills to be informed messengers and partners in conversation? Well, we have a course here at UW-Madison in the vet school called Artificial Intelligence for Veterinary Medicine and Life Scientists. And in the middle, you can see, I'm looking at my slide. But anyways, we are training students, veterinary students and life science students to acquire the knowledge for first making their own, creating their own AI systems and putting this into context. We have models to detect tumors in sea turtles or to score teeth end lesions. We have models that will classify the eggs of parasites in fecal samples of small animals. So this is reduced to AI applied to images and videos, but you can apply AI to data spreadsheets if you want, data arrays. And in the lower right of my slide, at least, if we could switch again to that slide for me, the lower right-hand side, you see the mascot of that course. It's a little Python snake, because we do all the coding and programming in Python, and the little mascot of the course is called PittyPat. And this is to symbolize all degrees of learning, all starting points of learning for programming and coding with regards to creating your own AI systems. This can be done at any stage of life and in any to any professional level. I'm sure that there are people in the room who would adopt these principles within an afternoon. And there are so many tutorials out there that can teach you how to create your own AI-supported cow signal detection systems. So on the left-hand side, you can see one of a Raspberry Pi. So this is a portable system with a tiny camera between my fingers. It is often used to create training situations. In the middle, you see two of my students who actually won an award of excellence for their research when they developed an AI computer-assisted system to detect paw inflammation, dermatitis in dogs. That's a big thing when it comes to allergy in dogs. Then the sea turtles, the teeth end lesions, and on the right, we have a ketosis predictor based on data spreadsheets. So artificial intelligence used for the augmentation of human skills in an ethical and responsible way embraces machine learning. So there you can think about spreadsheets that are used to make prediction models, and deep learning is something that you hear. That's another discipline within the machine learning realm, just for you to see the difference between prediction models and parameter estimation models. This is very theoretical, but imagine a spreadsheet of data that can be exported from DairyComp, for example. We developed a system called Dairy Copilot, where we actually automated the extraction of data spreadsheets from DairyComp. We clean this up automatically, we format it automatically, and then the result is a formatted system. I have to scare my cat. I was doing strange things. Stop it. Sorry, I have two cats here watching my presentation. But Dairy Copilot is able to automate the data compilation, editing, formatting, and analysis. So you would have an interactive tool where the data are read into directly from DairyComp. We make graphs, we do statistical tests, cross tables. So this augments your skills and possibilities, so that without being a statistics expert, you're able to extract and quantify information about risk factors associated with, for example, treatments and lameness and trimming and so forth. So putting this into the hands of people who like to increase their skills and their analysis skills, this would be an automated tool, which I think as hoof trimmers, you should consider in adopting. And then the reaction often is, and this includes the president of ABP here, the reaction is like, no one is hoping for more desktop time. We don't need this type of tools. I disagree. We have to have at least heard about this type of tools and adopt them as we go. Then artificial intelligence helps with early and systematic detection of DD. Because the cameras can be installed at eye level, also eye level with the feet, at the entrance to a milking parlor, at the exit of foot baths. We can trigger sort gates with the detection results. On the right-hand side, you see this little portable machine that we had in Minnesota last year, a year ago. In the middle, you see a cell phone held to the oculus, to the lenses of a microscope. So there and then you can detect, these are the eggs or fecal samples. We use many tools from Python to make this happen. And again, there's this artificial intelligence for veterinary medicine and life sciences course. It's a 2-week full immersion course that just completed in June. And early systematic DD detection, you have to imagine, for example, a milking robot here. There's a little toy milking robot on the left. And there are 2 cameras, one looking in the front, reading ear tags, and the one in the back detecting these DD. And then everything is that is detected is written out into a spreadsheet that you see in this gray shadowed bottom part. So we can read out what is the cow ID and from what is the starting date and time when a detection happened and when did it end, which M stage of DD was detected, and what is our advice in terms of action: treat, wash, or do nothing. And you can imagine that this action recommendation can be translated into sort her to the left or right for treatment, or present her as an animal for treatment by a hoof trimmer. Yeah, so this is all possible. These cameras are waterproof. They use local networks, so you're not dependent on the internet. And they do this in real time. And this FPS unit there actually stands for frames per second. And if you are within the realm of 20 to 30 frames per second speed of the real-time detection of DD, you're already happy. We do the detection today at 36 and up to 500 frames per second, which is actually overkill. And you can see that this blue box in the lower right and the upper right hand side corner of the slide, these blue boxes are the detections that are successful on the feet in the lower right, and on the ear tags being read for animal identification in the upper right. So this is all working together and written out into treatment lists using these stationary waterproof cameras. And then on a dairy farm with about 9,500 cows that are milked in a milking carousel twice per day, we have installed, as you can see in the upper right-hand side corner, we've installed security cameras actually in the front to read the ear tags, and then in the back, as is symbolized in the lower right-hand side corner, these security cameras, they feed into a microcomputer and then generate those spreadsheets that can be used to generate treatment lists. It's not quite optimal yet, but it's working in real time because these cows actually move very fast on the carousel. We have 4 seconds per cow to make the detection. So there, this frame per second becomes really important. Many other applications like signs of heat stress or quantifying drinking behavior. Here as well, you want to be identifying the cow or beef cattle in this, beef steers in this case, as who is there and is and what is the number read on that ear tag, and is this animal drinking or not? Because if you can quantify how much they're drinking, you would be able to assess heat stress as one of the signs of heat stress if you wanted to. And this can be read out, this can be associated with the volume of water in these troughs. Many possibilities. This can be done in a portable way and has been done and is continued to be done by a 4th-year undergraduate student at UW-Madison in the computer science department. She has won several awards for this and has submitted her first publication. Artificial intelligence helps with early and systematic detection of disease. And here you see GoPro cameras taped to different devices like posts. So you may be seeing this in the lower half of the slide. So posts, metal posts that are close to hospital pens, in sales barns, attached to the lower legs of pen walkers, attached to stirrups. And these are all locations that can be used for the detection cameras later. And the adoption of this system is amazing. So the cowboys are ready to have this. Like the first question of the gentleman that's sitting on that horse in the right-hand side of the slide was, okay, is it gonna vibrate or give me a sign when it sees DD? And his other reaction was like, no, my phone, I need my phone for other purposes. I cannot, it's not available for DD detection. So there is room and space for having extra devices in this environment that are not phones. But phones are so compelling because they're very flexible, they're present everywhere. If you think about regions that are remote in the world, I think phone apps will play a huge role when it comes to detecting any disease that is AI supported. So I want to switch gears just for a second here from the cowboys somewhere in the Midwest of the United States to a movement with regards to responsible AI. And this is a slide that I am acknowledging to belong to Dr. David Martinez at MIT in Massachusetts, who talks about responsible AI and systems engineering for AI. And the central message here is, if you generate one of these AI models, that's cute, right? That's kind of nice. It will change anyways very soon. But you have to find a way to implement this in a systems engineering way of thinking. Otherwise, the model will just disappear or will be swallowed by your competitors. And that's very normal, a normal thing to happen. So responsible AI, that means today, there more than ever, we are facing a great threat, actually, from overusing these very, very complex systems. And AI models for prediction of disease are actually pretty complex. And Henry Kissinger wrote a piece where he said, well, we don't know when any mistakes will happen. We don't know what the consequences of these mistakes are, and we don't really know where they come from because the systems are so complex. Therefore, we have to think, and this is Dr. Martinez's claim to the fast steps system, we have to think about fairness of AI systems, the accountability of people using them in terms of where do your data come from, are they safe to use? You have to be transparent about where the data come from, the ethics with regards to implementing these AI systems, the privacy of the data, like to whom do the images belong to that we're using to train these models. You're all aware of the ChatGPT 3 and 4 discussions right now with regards to privacy and the security of data. If we make data available to people who want to generate AI systems like the computer vision models to predict DD stages, then there has to be security that these images are located somewhere in a secure way and are not misused by other parties. Yeah? So we have to think about this and we have to talk about this. So when I talk about AI systems engineering, again, the slide here in the middle is borrowed from Dr. Martinez from MIT, then we have to think about the big chances of these AI systems.
Hello, Dörte. We need to start finishing.
I'm finishing.
Oh, you are, okay.
Oh, I'm so finishing. No idea. But according to my clock, I have 7 more minutes.
Okay, good.
But I can finish now if you prefer, no problem.
No, if you prefer, we can finish in 5 minutes. Okay, Dörte? And if anyone has some questions, we can make some questions. Good?
Okay, I'll jump this. I think my message is clear. A model on its own does not really produce the effect that we want. We have to think about AI and the system around it. See, here's my final slide. I want to thank all my collaborators over the years. I want to thank you all, my producers, my colleagues, my students, my collaborators. If you are interested in what I'm up to when I'm not checking cows' feet, I paint, and there's a permanent exhibition of my paintings by now that you can have a look at if you scan this QR code. This is not any commercial thing or marketing thing. This is about showing that cows can do very well in human care. And I think preventing and controlling digital dermatitis in the long term is actually taking good care of them, and taking good care of cattle in our environments is part of our culture, is part of what cattle people do, and hoof trimmers, veterinarians, consultants, we are all interested in these animals doing very well, because if the animals do well, then the people associated do well. The food security, food quality, food safety actually does much better, and AI has a lot of potential to augment that well-being of cattle in general. So with this, Danielle, I'm handing over, and if there are questions, feel free. Otherwise, you can email me as well. Thank you all for your patience with this, and maybe one day we meet in person again.
Yes. I would like to make a huge clap in order that she can listen from Wisconsin. Okay, please, in order that she can see you from the camera. So arise and say hello to Dörte.
Thank you so much.
Do you have any question?
Thank you for a really good speech. I'm from Sweden. We are very blessed about this DD because we have very cold weather in Sweden and also in Finland. I trim in Sweden and in Finland. And we knew that this heat, global heat come, then the DD is coming up to Sweden also. I have never seen that big DD you have in the third picture. The first I have seen that, because when we knew we had you know about Christer Bergsten, I think he said, we were prepared of this DD, and we start to find solutions to stop it in how to say in the before it come to Sweden. But we have it now, but not in the big like we have in Europe. We use much foot bath, and I think 7 days in every 3 weeks foot bath with copper sulfate, and every DD we use salicyluric acid. And when we treat that, it's always in 1 or 2 weeks we have this. We have only this picture one, and in 1 or 2 weeks when you take off then it's gone. So I think also it's the heat and the climate in the barn is very it's important. Is it what do you think also?
So climate is very important because it's associated with hygiene. And I think what you're mentioning, well, first of all, congratulations that you are able to treat the DD lesion successfully. That's really good. And I think what we have to be aware of in terms of global warming and climates changing towards the warmer climates and towards the more unpredictable climates as well. I think part of this, what you're mentioning, is that in Sweden, climate is more constant and more evenly distributed over the seasons. But with global warming happening, I think that the warming of waters and bad hygiene environments will contribute to more infectious diseases spreading, amongst which DD. And one aspect that I didn't mention is, but the emergence of antimicrobial resistance factors in those DD lesions is quite significant. So I think every lesion that we can prevent is a prevention of antimicrobial resistance factors at the same time. So if we can actually significantly delay outbreaks of DD using, for example, as pieces of the puzzle, these feed supplements, that's a big chance for the prevention of antimicrobial resistance factors emerging. And this is part of the discussion where the cattle husbandry is under fire by the public opinion. The use of antimicrobials, the use of any treatment agents with regards to these food-producing animals will be increasingly regulated, and I think Scandinavia is there a pioneer in how to regulate antimicrobial use, and with success, as you say, that your treatment and prevention strategy is successful. So I totally agree that climate change is associated with infectious diseases and, among others, digital dermatitis outbreaks. Thanks.
Thank you, Dörte.
Have a wonderful continued meeting.